The measurement of vital signs, sometimes abbreviated VS, is an important part of patient care because it reflects the physical well-being of the patients that you're taking care of. Hi, I'm Kathy Gatrust, and today's topic of conversation is going to be on pulse, respiration, height, and weight. Pulse and respiration, along with temperature and blood pressure, and more recently, pain, are considered the vital signs. We're going to be discussing height and weight today as well. Height and weight really are not considered to be vital signs, except that they're frequently done at the same time as vital signs are done, so that's why we're discussing them jointly. Well, what is pulse? Pulse refers to the number of heartbeats per minute. Pulse is the pressure of blood that is felt against the wall of an artery in the heart, alternately contracting, which is when the heart is beating, and when the heart relaxes or rests. The pulse is more easily felt in arteries that come closer to the skin. However, the arteries reflect pulse regardless of where it is in the body, deeper or close to the skin as well. The pulse is an indication of how the cardiovascular system is meeting or not meeting the patient's needs. There are many places called pulse points where a pulse can be felt. The most common ones are the carotid pulse, and the carotid pulse is at the neck. There's the apical pulse, the pulse that is heard and felt at the heart, and the one that you will use most frequently called the radial pulse. The radial pulse is at the wrist. This radial artery at the wrist is on the thumb side of the wrist, and I'd like you to see if you can find your radial pulse. If you look at your hand and have it palm side up, locate your thumb and move your opposite hand down the thumb to the center of your wrist, and if you put 3 fingers across your wrist, most likely you will be able to palpate or feel your pulse that's beating in the radial artery on the thumb side of the wrist. There are a number of things that you need to observe when you are taking the pulse. The first, of course, is the rate. What's the speed, or how fast is the pulse going? And that's determined in beats per minute. The other thing you want to determine is the rhythm of the pulse. Is it a regular boom, 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 boom rhythm, or is it irregular? Boom, 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 boom. There is no natural rhythm to that. It's important to note whether it's regular or irregular. The third thing is the force. How strong a pulse are you feeling at the wrist? Is it weak? Sometimes it's called thready. Or is it strong? Is it bounding, kind of a pulse where you can literally see the pulse? There are many factors that affect the pulse variations. Some of the reasons why a pulse will be increased is due to exercise, heat, stress, pain, and certain drugs. There's also a number of reasons why a pulse rate might be decreased. Some of those things would be when we're at rest, when we're feeling very relaxed, when we're asleep. People with certain heart diseases will have maybe a slower pulse. And again, drugs can conversely cause an increase in pulse rate as well as a decrease. Some important things to remember with pulse measurement. A change in one of the vital signs will frequently cause a change in another. For example, when the body temperature rises, it's usual that the pulse and the respirations as well will also rise with it. The normal pulse rate will change with age. Infants, for example, have a very fast pulse rate. It can be from 120 beats a minute clear up to 160 beats a minute. And as we age, it slows down. The adult pulse rate range is between 60 and 100 beats per minute. You would want to report any pulse rate that was above or below that normal range of 60 to 100 beats per minute. Along with reporting that change in rate, you would also want to report any irregular pulse, including the rhythm and force, immediately to the nurse or person in charge. It's important to use gentle pressure, especially if a patient's pulse is weak, because pressing too hard on the pulse may eliminate your ability to feel it. So try not to use too much pressure when you are trying to locate the pulse. If you have difficulty obtaining a pulse and you just can't feel it, or you might be able to feel it for a little bit and then it seems to fade away, try the person's other wrist. Lots of times there is an ability on one wrist to feel a pulse much more capably than on the other. Never use your thumb to locate a pulse. And the reason for that is that our thumb has a pulse that is felt very near the skin, and it can be confused with the pulse that you're trying to determine from the patient. To take a pulse and respiration that we'll be talking about a little bit more in a bit, you'll need to use a watch with a second hand. In many of your facilities, you will have a watch, much like you're seeing here, that has a sweep hand. It's a large, old-fashioned kind of a clock. If you don't have that in the patient room, you would probably want to use a watch similar to the one that I have here. I have one that's quite large. It has a second hand. It has all of the numbers on it rather than just lines, and it makes it very easy for me to accurately check a pulse without any confusion that it might be incorrect. Now I'd like you to watch a demonstration of taking a radial pulse. Taking a radial pulse. Wash your hands. Position comfortably with arm resting on a flat surface or across the chest. Use the first 3 fingers to locate the radial artery on the palm side of the wrist in line with the thumb. With a watch, count the radial pulse for 60 seconds. If the pulse is regular, you may count for 30 seconds and multiply times 2. Measure the rate, rhythm, and force of pulse. Record the measurement on a notepad. Wash your hands. Report to the nurse any deviations from normal. Now that you've seen the demonstration on taking a radial pulse, I'd like to move on to respirations. Respirations is the process of breathing oxygen in and carbon dioxide out of the lungs.